KK's a 29-year pancreatic cancer survivor, one of the world's longest living pancreatic cancer patients. In comparison with the 4 other forms of cancer that claim most lives, pancreatic cancer is the least funded and toughest to detect, but this wasn't something KK's planned to sit back and accept. One of the longest living pancreatic cancer survivors out there, Kay first began battling the deadly disease back in 1994 after suffering severe back pains. Initially, she was thrilled to find out she wasn't dealing with gallstones, but her joy was short-lived as she soon learned, thanks to the help of some diligent interns, that she had pancreatic cancer. Likening the diagnosis to, quote, getting hit by a freight train, she had little time to let the news sink in before finding out she was a candidate for the Whipple procedure, which involved, as she put it, an, quote, extensive replumbing of the digestive system. Soon after having the head of her pancreas removed, she learned that she not only had pancreatic cancer, but that she had cyst mucinous endocarcinoma, a rare, slow-growing form of the disease for which there was no form of treatment available. Without chemotherapy or radiation as viable options, Kay's doctors told her that, should her cancer return, she would likely succumb to the disease within 4 to 6 months. 5 full years passed before Kay found out that the cancer had in fact returned to what remained of her pancreas, at which point she had both her pancreas and spleen removed. She felt hope for the first time in a long time, but that hope was short-lived as she soon learned the cancer had metastasized to her lymph nodes. At this point, doctors deemed her inoperable. But after reading an article in a newspaper about pancreatic cancer researcher Dr. Daniel von Hoff, she made an appointment to meet with him and ultimately ended up signing on as one of his first targeted therapy patients. 3 years later, her cancer re-emerged in her lung, and she ended up having a portion of it too removed. Now, 25 years later, she may not have a pancreas, spleen, gallbladder, or a full lung, but she has something arguably just as invaluable: hope. She's also become an ardent patient advocate, helping patients come to terms with their diagnosis and treatments while touting the work of Dr. von Hoff. "The man is a bulldog," she said, noting that he's known for pulling out chairs for his patients and urging them to call him Dan. Quote, "He's not only a fantastic researcher, clinician, and mentor, he's a fantastic patient advocate. He's more patient-oriented than any other doctor I've ever met." Quote, "I've survived a very long time after being first diagnosed with pancreatic cancer. It's important that my story is being told because people need to know that a diagnosis of the worst of cancers does not mean an automatic death sentence. Patients are living longer and longer as medical advancements are occurring at a more rapid pace. Sustaining hope and courage is so important."